Okay, so we will talk about the tissues. Okay. Um, Histology is the term when we study about the tissues. So tissues are composed of cells. Okay, so primarily our body are composed of combined cells, and they are classified into four. Okay, so the four types of tissues, we have the epithelial tissues, the connective tissues, the muscles, and the nervous tissue. So these are of all the billions of cells that we have in the body, they are categorized and organized into four types: epithelial, connective, muscles, and the nervous tissues. So as I said earlier, when we study or when we deal with the um, microscopic structures of tissues, we are dealing with histology. So all tissues came from from embryologic origin. Okay? So when we talk about embryonic tissues, we are dealing with where do those four types of tissues came from. Okay, they came from the germ layers. There are three germ layers: the endoderm, the mesoderm, and we have the ectoderm. So the tissues that lines the digestive tract and its derivatives, they came from the endoderm, and the tissues that came from um, the tissues of the muscles and the bones and the blood vessels, they came from the mesoderm, and the tissues that forms the skin and the nervous system, they came from the ectoderm. And so these germ layers will be discussed more in details when you get into normal OB. Okay, most probably third quarter from now or fourth quarter from now. Okay, so as I said earlier, those four types of the tissues, the connective, the epithelial, the muscular, and the nervous tissues, they came from the germ layers. Okay, so let's talk first about the epithelial tissues or the um, epithelium. So the epithelium, it covers the body surface and forms of glands. So say for example, our skin, okay? Our skin is composed of epithelial tissues, okay? It mostly, okay, ang pinaka maraming tissues that we have in our body are epithelial tissues. It has free and basal surface. So when we say the free surface, ito yung pinaka ibabaw, okay? Pinaka ibabaw na surface ng epithelium, tapos underneath niya, okay, before the next tissue, like for example, before ng ng muscle, meron tayong basal surface, okay, or the basement membrane. Epithelium has specialized cell contacts. Sometimes it is avascular. And so when we say avascular, it has no no
Vein.
supply of blood. Okay. So in our in our skin, for example, yung inner portion or inner part of the skin, meron pa yung mga capillaries. But as the skin tissues, okay, goes out, nawawalan yan ng supply, okay, and later on Okay, na-disconnect ako. Okay, continue tayo. Hello? Hello?
Yes.
Okay, okay, sige. So, as I said earlier, epithelial tissues is a vascular and it another characteristic, it undergoes mitosis. So when we say mitosis, it continuously replicate, duplicate, because it has the function to undergo cellular division through the process of mitosis. So ano yung functions ng epithelium? Okay, it protects underlying structures like our skin. It protects our muscles and the bones and the organs underneath. It acts as a barrier. It permits the passage of substances, and but not all substances pass through the epithelium. Semi-permeable lang yan siya, depending on the structure, the characteristics, and the likelihood of the substance to pass through the epithelium. It secretes substances like our glands, okay? Both the endocrine and the exocrine glands secrete substances. Say, for example, for the endocrine glands secretes hormones, and exocrine glands secrete certain enzymes like pancreas. It absorbs substances. So, like for example, the linings of our digestive system, the intestines and the stomach absorbs nutrients, which composed of epithelial tissues. So we have classification of epithelium. We have the simple, stratified, and pseudostratified, and we have transitional. So types of simple epithelium, we have simple squamous, simple cuboidal, and the simple columnar. We also have stratified squamous, stratified cuboidal, and columnar. And then we have also pseudo stratified columnar. So when we say pseudo stratified, it looks like stratified, but it's not entirely stratified. Kaya pseudo means false. Then we have transitional epithelium. When we transitional, it changes or it modifies from cuboidal to columnar when not stretched and squamous-like when stretched. So, uh, the simple squamous epithelium, commonly it lines the blood and lymphatic vessels. So, simple squamous, common siya sa blood and the lymphatic vessels, the small ducts, the alveoli of the lungs, the loop of Henle in the kidney, and the linings of serous membrane. So, the loop of Henle, this is specific part of nephron, okay? The nephron or the structure of basic structure of the kidney. So simple squamous are single layer of flat. So take note, single layer of flat, simple squamous yan. Usually hexagonal. So when we say hexagonal, it has six sides. Okay. The nuclei appears as bumps when viewed as a cross-section because the cells are so flat. So anong function ng simple squamous? Diffusion, filtration, and protection, secretion, and absorption. Okay? Then we have the simple cuboidal, commonly located in the kidney tubules, the glands of the ducts, choroid plexus of the brain, linings of the terminal bronchioles of the lungs, and surface of the ovaries. So this is also a single layer. Kaya lang cube shape siya, kaya tinawag siyang cuboidal. Ang function niya, active transport and facilitated diffusion, which result into absorption by cells of the kidney tubules, secretion of glands and the choroid plexus, and movement of particles embedded in mucus out of terminal bronchus by ciliated cells. Okay, so we have another one, um, the stratified squamous epithelium. The stratified squamous, stratified siya kasi multiple layers yan siya. And sometimes cuboidal and progressively flattened towards the surface. Um, the surface cells in a stratified squamous retain a nucleus and cytoplasm. So, yung function ng certified squamous is protection against abrasion and infection. So, essentially, our skin is composed of stratified squamous epithelium, our hands, okay? The cornea, the skin, the mouth, the esophagus. Okay? Then we have a stratified cuboidal. Um, Common siya sa parotid glands, the sublingual gland, and the submandibular gland. So these three glands, they secrete our saliva. Okay. We also have the ovarian follicular cells of the ovary and the sweat gland. So again, stratified siya because it composed of multiple layers. Cuboidal kasi cube shape. Yun yung ano, yung um, terminology, okay? So, ang function niya, secretion, absorption, and protection against infection. Okay? So, next, we also have stratified columnar, multiple layers of more cuboidal cells that functions also for protection and secretions. Siya sa mammary gland, your mammary gland of your breast, the larynx, and the portion of the male urethra. Okay. Then we have the pseudo stratified columnar epithelium. Okay. Um, Pseudo stratified siya kasi akala mo stratified siya pero single layer lang pala siya ng cell. Kaya pseudo stratified siya. Okay. Some cells are tall and thin and reach the free surface and others do not. The nuclei of these cells are at different levels and appear stratified. Okay. Like your linings of your nasal cavity, the nasal sinuses, the auditory tubules, the pharynx, and yung respiratory tract most commonly are pseudo stratified columnar epithelium. They synthesize and secrete mucus onto the free surface and move mucus that contains foreign over the surface of the free surface and from passage. So essentially, your phlegm, okay, or your sputum that has been coughed out from your respiratory tract, okay, nanggaling dito sa pseudo columnar epithelium because they produce the mucus, okay, when there are irritants or foreign particles in your respiratory tract. And then we have transitional epithelium. Um, it lines the urinary bladder, the ureters, and the superior urethra. Stratified cells that appear cuboidal when the organ or tube is not stretched, and squamous when the organ or tube is stretched by fluid, like your urinary bladder, your pantug. It accommodates fluctuations in the volume of fluid in an organ or tube, protection against the caustic effects of urine. Okay? So functional characteristics of epithelium, um, simple epithelium, that is one layer, diffusion of gases, filtration of blood, secretion of cellular products, absorption of nutrients. So for certified epithelium, protection, and found in body areas where abrasion can occur. And di ba sometimes kung ano kita, may ada kubal, yung keratinized part of the skin na medyo makapal, yon, they are composed of stratified epithelium to protect against abrasion. Okay, then we have smooth um, surface of the epithelium that reduces friction, like the covering of the serous membranes within your respiratory tract or your digestive tract or your blood vessels. Okay, and then um, the microvilli, okay, this is composed of epithelial structures, increase the surface area absorption or secretion or but are non-motile. So, yung surface ng tissue or yung cell, there are tiny projections. Ang tawag nun ay microvilli that increase the surface area absorption. And then bigger than the microvilli, we have the cilia that helps to move materials across cell surface. So we have ciliated epithelium that is found in the respiratory tract. And we have also transitional surfaces. These are rigid epithelium separated by flexible regions specialized to expand. Like our um, urinary bladder of the urinary system, or the urethra, or the ureters from the kidney, right? So sometimes or other functions of the epithelium is for connections. Okay, so when we say for connections, it binds cells together. So together, one cell is attached to the other cell, or it forms permeability layer. So the epithelial tissues allow the surface to penetrate some substances, but not all, huh? But not all. And then it is involved also in intercellular communication, like in transmitting neurotransmitters or chemical ligands or some other forms of chemicals. So we have an example for that. We have the desmosomes and hemidesmosome. Okay? The desmosome and the hemidesmosome, the type junctions, without type junction, and the gap. Okay? Cell connections serve to hold cells together or to the basement membrane. It helps to form permeability barrier. It provides a mechanism for intercellular communication. So specific structure of the cell connections, the desmosomes, adhesive glycoproteins that bind cells to one another. And we have the hemidesmosomes. It attaches cells to the basement membranes. So we have zonola adherens type junctions and the zonola occludens. The zonola adherens that is found between the plasma membranes on lateral surface of the cell and the zonola occludens that join cells in a jigsaw pattern to form a tight glue. Then we have the gap junctions, a small specialized contact regions between cells containing channels that helps to facilitate the travel of certain substances. It aids in intracellular communication by allowing ions and small molecules to pass through from one cell to another. Okay? It also pass electrical signals from cell to cell. Like for example, your neurons, meron yung tight junctions, gap junctions in between the myelin sheaths that transmit electrical signals from one part of the neuron to the other. Okay. Then we have glands. Aside from the connection, we have glands. Glands are secretory organs composed primarily of epithelium with a supporting network of connective tissues. So we have, as I said earlier, exocrine glands, and we have the endocrine glands. Exocrine glands have ducts. So when we say ducts, meron siyang daluyan. Um, an open contact with the epithelium from which it developed. It could be either multicellular or unicellular. It is simple or compound. It has tubules like the merocrine, the apocrine, and the holocrine. Okay? Like our skin, we have the apocrine gland that secretes the sweat. Okay? Ang pinagkaiba ng exocrine sa endocrine, ang endocrine, it has no ducts. Okay? It secretes hormones. Okay? Then we have the goblet cells. Goblet cells produce mucus. And these are these are cells that lines the exocrine glands. These are examples of exocrine glands. So uh, meron tayong simple, so isa lang siya. Meron tayong simple pero branched, ang coiled na simple, and acinar. Okay, so when you say acinar, meron siyang enlargement at the end. So meron din tayong compound exocrine glands. Yan. So merocrine are sweat glands. Apocrine are mammary glands, and holocrine are sebaceous glands. Okay. So again, example of merocrine, we have the sweat glands. Example of the apocrine, we have the mammary glands. An example of the holocrine are the sebaceous glands. So sebaceous glands, these are glands that secretes sebum-like structures or substances. Para siyang oil. Okay? So the next type of tissue, we have the connective tissue. Connective tissue is abundant. It consists of cells separated by extracellular matrix. It is diverse. Iba-iba. Marami. It performs a variety of important functions. So ano yon? Enclosing and separating as capsules around organs. Connecting tissues to one another like the tendons and the ligaments. It supports, okay, and moves structures like the bones. It stores as fat. So yung mga fats natin sa ating tiyan, um, sa ating katawan, they are composed of connective tissues. It motions and insulates. It transports substances like our blood. So blood is composed of connective tissues. And of course, it involves in protection against infection. Okay. Usually, connective tissues, it forms extracellular matrix, such as those that ends with blasts. So, osteoblasts, um, ano pa yun? Myeloblast for the blood, thromboblast, yun. Or sites. Okay, so blasts create the matrix. Sites, we have maintains the matrix. Osteocytes, thrombocytes, leukocytes, yun. Or clasts. When we say clast, it breaks the matrix. Osteoclasts, okay, for remodeling. Then we have adipose or fat cells, or the adipocytes. Then we have also mast cells that contains the heparin and the histamine. Okay, so heparin, it thinns the blood, the blood. Naglulusaw ng dugo. Okay? And we have the histamine. Okay? The substance, for example, involved in vasodilation, okay, or vascular permeability from allergy. Okay? Then we have the white blood cells that respond to injury or infection. And then we have the macrophages and the phagocytes. Phagocytes are provide protection. Could be either fixed, okay, or attached lang siya in a particular structure, or wandering, okay, within the circulation. Okay? And as a matter of fact, macrophage is a type of white blood cell. Okay? And then we have the stem cells. Okay? Ito yung ating origin ng mga cells, okay, the embryonic cells. So what are the components of extracellular matrix? We have protein fibers, and protein fibers that are, um, example, we have the collagen, most common protein in the body, wherein 1/4 to 1/3 of our total body protein is collagen, or 6% of our total body weight is collagen. It resembles a microscopic rope of three polypeptide chains tied together. It is strong, flexible, but inelastic, in stretch. Okay, so we have 15 types and six most common. We have the bone, the dentine of your teeth or tooth, the cementum, cartilage, and reticular. Type 1, type 2, and the type 3. Then we have reticular, very fine short collagen fibers that form a network. It fills spaces between tissues and organs. We have elastic. It contains the protein elastin, which returns to its original shape after distension or compression. It looks like tiny cold springs. Then we have the ground substance. These are non-fibrous proteins and other materials. It is shapeless background against which collagen fibers are seen. Then we have the hyaluronic acid. So sometimes this substance is ano, taken as supplement. Bakit kailangan ng hyaluronic acid? Okay? So these are long unbranched polysaccharide that has a slippery quality. It acts as a lubricant in joints, connective tissues, and vitreous humor of eyes. So hyaluronic acid, this is a type of carbohydrates. Okay, carbohydrates that provides as lubricants. Okay? Then we have the fluid of the extracellular matrix. And another extracellular matrix component is the proteoglycan. Large molecules of numerous polysaccharides. Uh, so again, this is a polysaccharide. Sugar na naman siya. I mean, carbohydrates na naman siya, made from protein and polysaccharides, resemble minute pine tree branches, proteoglycan. So, from the term proteo, okay, meron siyang protein component, and the glycan, meron siyang carbohydrate component. It attaches to hyaluronic acid, forming a proteoglycan aggregate that traps large quantities of water and gives ability to return to the original shape when compressed or deformed. It has adhesive molecules that holds proteoglycans together, like the chondroitin in your joints, which are cartilages, osteonectin, and then fibronectin. Okay, so categories could be based from protein fibers and their arrangement in the extracellular matrix, protein fibers and ground substance in the extracellular matrix, or a fluid extracellular matrix like the blood. Okay? So these are the classifications of connective tissues. So when we focus on the adult connective tissue, it is either loose or dense. Okay? Dense connective tissues are either regular and irregular. And like irregular collagenous dense connective tissues or irregular, elastic, dense connective tissues. We also have regular collagenous dense connective tissues and the regular elastic dense connective tissues. Then we have specialized connective tissues like the adipose and reticular tissues. Then we have the cartilage that lines in the joints and the bones. And of course, the bones. And the last, we have the um, hemopoietic tissues and the blood. So hemopoietic originates from the blood itself. Okay. So embryonic tissues, it could be either mesenchyme or the mucus. The mesenchyme, regularly shaped fibroblasts surrounded by abundant semifluid extracellular matrix in which collagen fibers are distributed. It forms in the embryo during the third or the fourth week of gestation from the mesoderm and neural crest cells. So, meaning to say, this kind of connective tissue is present only during embryonic stage. So, kung baby pa or embryo pa yung bata. Okay, by 8 weeks it specializes into various adult connective tissues. So loose connective tissue is otherwise known as areolar. Okay? It forms a lacy network with plenty of fibers. Okay, so these are loose packing materials that are most commonly found on most organs and tissues. It attaches skin to underlying tissues and it contains collagen, particular elastic fibers, and variety of cells. Then we have dense connective tissues. It forms thick bundles that nearly fill the entire extracellular space. It develops from the spindle shaped fibroblasts. So once fibroblasts become completely surrounded by matrix, they are called fibrocytes. Okay, yung nag-maintain ng matrix. There are two major groups. We have the regular and the irregular. So dense regular has abundant collagen fibers like your tendons that connects muscles to bones, the ligaments that connects bones to bones. Um, we have the dense regular elastic like the ligaments in your vocal fold or your vocal folds in your larynx. And then we have the dense irregular um, connective is happening. Okay, so we have the scars. The scars are dense, irregular connective tissues. We have the dense, irregular collagenous, like the dermis of the skin. And dense, irregular, we have the walls of your elastic arteries of your blood vessels. So this is an example of a dense, regular collagenous connective tissue. Then we have the dense, irregular collagenous connective tissues and the dense, irregular elastic connective tissues. Okay, collagenous in the skin, elastic on your arteries, like in your aorta. Okay, Connective tissue with special properties, we have the adipose, consists of the adipocytes, could be either yellow adipose tissues and the brown adipose tissues. Yellow adipose tissues most abundant with it has a white appearance or yellow. It turns into yellow with age. The brown is found only in specific areas of body such as your axillae, the neck, and your near kidneys. We have the reticular tissues that forms the frameworks of your lymphatic tissues. It is characterized by network of fibers and cells. So yun, yung adipose tissue dyan sa may breast ninyo. So we also have reticular tissues. Um, have your mga lymph nodes, the tonsils, thymus, spleen. And next, let's proceed to your cartilage. It is composed of chondrocytes located in spaces called the lacunae. It is next to bone, firmest structure in body. So the bone is your firmest, or could we could say the hardest. Next to it is the cartilage. We have hyaline cartilage, fibrocartilage, and elastic cartilage. So hyaline cartilage, it is found in areas of strong support and some flexibility, like your joints, um, the rib cage, and the cartilage in the trachea and the bronchi. It forms most of the skeleton before replaced by bone in embryo. It is involved in growth that increases bone length. So it is in the hyaline cartilage that promotes the elongation, okay, or the increase in length of your bone. Then we have the fibrocartilage, slightly compressible and very tough. It is found in areas of body where a great deal of pressure is applied to joints, like your knee, your jaw, or between vertebra or vertebrae. Then we have your elastic cartilage dyan sa tainga ninyo. It is rigid but has elastic properties like your external ears and your epiglottis. Next, you have the bone. These are hard connective tissue that consists of living cells and mineralized matrix. And mineralized, like bones, is composed of calcium. And it could be either organic and inorganic, like cancellous or spongy bone, compact bone. So cancellous bone natin is like, for example, yung yung some parts of the skull, or yung compact bone natin, yung bones natin sa hands, or even your arms. And then we have the blood. Okay, these are the liquid matrix of connective tissue. Could be either hemopoietic. The hemopoietic, they are the tissue that forms the blood, and the blood are produced, okay, or synthesized in the bone marrow. And so the bone marrow is composed of yellow or the red marrow. Okay? Then we have the third tissue. The third tissue will be your muscle tissue. And ano yung muscle tissue? It contracts or shortens with force. Diba? Kung nag-flex tayo ng muscle, with either it shortens and it moves the entire body and pumps blood. It has three types: skeletal, cardiac, and the smooth. Okay, skeletal are striated and voluntary. Cardiac are striated but involuntary. Smooth, non-striated, and involuntary. So we have the skeletal muscle. Most of our muscles are skeletal muscles. Nagbibigay ng ating biceps and the triceps. Okay? Then we have the cardiac muscles, the muscles of your heart. And then we have the smooth muscles, like your muscles of your intestine, the muscles of your blood vessels. They are composed of your smooth muscles. The muscles of your stomach, mga smooth muscles lang. Okay? And then we have the nervous tissue. The nervous tissue is found in the brain, the spinal cord, and the nerves. It has the ability to produce action potential. It could be either the nerve cells or the neurons that compose of the dendrites, the cell body, and the axons. It could be either multipolar, bipolar, or unipolar. Okay? Aside from the nerve cells, we have the neuroglia. Okay? The neuroglia or the glial cells or the support cells. There are 5 types of neuroglia. Okay, so this is an example of a neuron. So ito yung kanyang cell body. Then yung mga tiny projections, the dendrites, and then we have the axon. And itong ano to, parang hotdog part or ano ba to, um, ito siya, meron siyang ano, space dyan, yung junction din yan. This is composed of a specific type of neuroglia, the myelin sheath, okay, composed of the Schwann cells. And then we have the membranes. We have the mucous membranes. It lines the cavities that open to the outside of body. It secretes mucus. Then we have the serous membranes. It lines the cavities that not open to exterior part. Um, like your pericardial fluid membranes, serous membrane, the pleural, the peritoneal, those are examples of serous membranes. Then we have the synovial membrane. It lines freely movable joints. It produces fluid rich in hyaluronic acid. Ano yung hyaluronic acid? Diba? Sabi ko kanina, it lubricates. Okay? So, let's talk about inflammation. It is inflammation or yung panhubag. A response when tissue is damaged or with an immune response. So, kung nahubag, meron siyang redness, heat, swelling, pain, or disturbance of function. So when we say redness, that is rubor, heat or calor, swelling or tumor, and pain or dolor. So mediators, ano yung nagpapa-inflame? We have the histamine, the kinins, the prostaglandins, and the leukotrienes. These are the substances na nagpapahubag. It stimulates pain receptors and increases blood vessel permeability. So how is tissues repaired? Okay, there is substitution of viable cells for dead cells. Skin repair occurs with primary union. The edges of wound close together. Then the wound is filled with blood. Clot forms. There are scabs. Sometimes there are pus, especially kung merong foreign substance or microorganism. Then there will be granulation tissues and scar eventually. Then the second, there will be secondary union or the edges of wound which are not closed. There will be clot formation, inflammatory response, mas matindi yung panhubag kung open lang yung wound, hindi dikit. And one contraction occurs leading to greater scarring. So, meaning to say, kung yung wound ninyo ay you let it open, nakabuka ka lang siya, hindi siya tinahi, okay? Or hindi deep, then mas matindi yung scarring kaysa sa wound na tinahi or mayroong primary union. Cells divide more slowly in older than younger people. Tendons and ligaments become less flexible and more fragile as age advances. Arterial walls become less elastic. Rate of blood cell synthesis declines in elderly. And of course, injuries are harder to heal among elderly. Any question? May tanong ba kayo?
I don't have.